Morgues and hospitals are full, while supermarkets and schools are empty. Hong Kong, once one of the world's best models for containing COVID, now has the highest death rate from the virus in the world. So how did a city with over 2 years to prepare go from success story to cautionary tale?
I think reasons for that were really to do with the very poor vaccination rate in the most vulnerable segment of the population, which is the elderly. We had basically zero community transmission for months on end. So it wasn't an immediate threat, it was something distant. And vaccination wasn't tied to any end result. So that led many people to basically swear off vaccines, especially among the elder population who had this absolutely unmovable misconception that if you have chronic medical conditions, then you shouldn't get vaccination.
When Omicron first hit Hong Kong at the beginning of the year, only around a fifth of elderly residents were fully vaccinated. That's since risen to 30%. But for the hundreds of unvaccinated elderly Hong Kongers who have died, it was already too late. In a way, Hong Kong had become a victim of its earlier success.
The kind of risk-benefit analysis that people undergo when they're considering vaccination is highly distorted in Hong Kong. So in many people's minds, there's a misconception that vaccines are as dangerous as COVID. There are many reasons for that, principally being a very, very steady drumbeat in the local media about deaths that occur after vaccination. Healthcare providers in Hong Kong haven't exactly helped a lot of the time, especially in the early days of the vaccination campaign. Honestly, everybody was so risk-averse that they failed to see the real threat.
The crisis in Hong Kong and its causes haven't gone unnoticed in Taiwan. On Monday, the CDC's daily press briefing saw direct comparisons between Hong Kong's elderly vaccination rate and Taiwan's.
很明显的看到80岁以上在香港打完1剂疫苗的是 51.15%， 那打完2剂的是只有 30.93%，这个比例真的是非常的低。相对于此，我们台湾事实上我们的75岁以上的长者目前是有 70% 的一个覆盖率，是比香港要多出1倍多。
Taiwan is doing much better than Hong Kong, but it is also far behind other regional peers like Singapore, where close to 95% of the elderly are fully vaccinated. Based on 2020 population data, there are currently close to 195,000 unvaccinated people aged 80 and over in Taiwan. If the country experiences a case fatality rate of 4 to 6% among the unvaccinated elderly, similar to that of Hong Kong and other Asian countries, it could potentially see over 11,000 preventable deaths nationwide.
70% is not going to cut it, unfortunately. We really need to get as many elderly vaccinated as possible, probably upwards of 90%. Put your focus on mitigation as well. The path to resilience lies in vaccination, getting as many elderly vaccinated as possible with at least 2 doses, and also stockpiling antivirals. We have to tackle vaccine misinformation head on. We have to call people out. We have to take innovative approaches to this. Catching COVID-19 has to be normalized to a certain extent, because unless somebody dies of something else beforehand, they're very likely to catch COVID-19 at some point in their lives. It's here to stay. It's another respiratory virus. Get used to it.
Taiwan's ongoing success in beating back its own COVID outbreaks has bought it still more time to prepare for the eventual impact of the virus's spread. Hong Kong's example provides valuable lessons in how not to do this. Before then, government agencies, health workers, media, and the public will all have a lot to do. Ryan Ho Kilpatrick for TaiwanPlus.